Imagine your body as a fortified city and the immune system as its vigilant guards. These guards are on constant patrol, looking out for any intruders that might pose a threat to the city. These intruders could be anything harmful: bacteria, viruses, or even rogue cells that could potentially turn into cancer. Now, these guards aren't just blindly attacking anything that looks out of place. They have a system, a set of rules that they follow to determine who is a friend and who is a foe. This is where the concept of immune checkpoints comes into play. Immune checkpoints are like the city's security checks. They are mechanisms that make sure our immune system does not go haywire and start attacking our own cells. Think of them as the guard's rulebook, a guide that helps them distinguish between the city's own citizens and harmful invaders. But what happens when someone learns to cheat the system? What happens when a rogue citizen learns to bypass these security checks? That's right, we get a dangerous situation on our hands. This is exactly what cancer cells do. These cells are not foreigners. They are our own cells that have gone rogue. They have mutated and started to grow uncontrollably. But to our immune system, they still appear as our own cells. Cancer cells can manipulate these immune checkpoints, essentially disguising themselves as normal cells. By doing this, they avoid detection by our immune system, allowing them to grow and spread throughout the body unchecked. So in essence, cancer is like a rogue citizen that has learned to bypass the city's security checks. But don't lose hope just yet. Scientists have been hard at work developing ways to help our immune system see through this disguise, enabling it to recognize and attack cancer cells. This is where immune checkpoint drugs come into play. But we'll get into that in the next scene. Now, what if there was a way to unmask these rogue citizens and make them visible to our guards once again? Welcome to the fascinating world of immune checkpoint drugs. These drugs are the secret agents in the fight against cancer, working tirelessly to expose the rogue cells to our body's natural defenses. Immune checkpoint drugs are designed to unblock the immune checkpoints in our body. In a healthy body, these checkpoints maintain the balance, preventing our immune system from attacking our own cells. But cancer cells, like good con artists, can manipulate these checkpoints, hiding behind them and evading detection. Here's where our secret agents come into play. Immune checkpoint drugs can essentially unblock these immune checkpoints. This action is like lifting the invisibility cloak off the cancer cells, making them visible to our immune system once again. Once visible, our immune cells can recognize these rogue cells for what they truly are and launch an attack. These drugs have shown promise in treating a variety of cancers. Melanoma, the most dangerous form of skin cancer, is one of them. Lung cancer, a leading cause of cancer death globally, is another. Kidney cancer too has been shown to respond to these drugs. But it's not just about these types of cancer. Studies are ongoing, and every day we're learning more about how immune checkpoint drugs can be used to treat different forms of cancer. Now, as with any treatment, there are pros and cons to consider. On the one hand, these drugs offer a new way to fight cancer, potentially making a huge difference for patients who have few other options. On the other hand, they can sometimes cause side effects, like an overactive immune response, that needs careful management. Looking forward, the potential of immune checkpoint drugs is vast. Researchers are exploring combinations of these drugs with other treatments, hoping to increase their effectiveness and potentially cure more types of cancer. These drugs, in essence, retrain the guards to recognize and eliminate the rogue citizens. And with that, we're one step closer to winning the battle against cancer. While this might seem like a perfect solution, the reality, as always, is a bit more complex. The scientific community is in a constant state of exploration, and immune checkpoint drugs are no exception. A multitude of studies are currently being conducted to further understand the effectiveness of these drugs and to identify ways to improve their functionality. Researchers are focusing on a wide range of cancer types, including lung, breast, and colorectal cancers, to name just a few. These studies aim to discover the full potential of immune checkpoint drugs, beyond what we already know. However, it's important to recognize the challenges that come with this territory. For starters, not all patients respond to these drugs. The human body is incredibly diverse, meaning that what works for one person might not work for another. Scientists are still trying to figure out why some people's immune systems respond to these drugs, while others do not. Another challenge is the potential for immune checkpoint drugs to cause the immune system to attack healthy cells. This can lead to a range of side effects, from mild symptoms like fatigue and skin rashes, to more severe issues such as lung or heart problems. It's a delicate balancing act, We want the immune system to attack the cancer cells, but we don't want it to turn against the body's own healthy cells. Plus, there's always the matter of cost. Developing, testing, and producing these drugs can be expensive, which often translates to high prices for patients. This is a challenge not just for the patients, but also for the healthcare system that needs to support and subsidize these treatments. Finally, there's the challenge of time. Research takes time, often years or even decades. And while we're waiting for the results of these studies, people are still suffering from cancer. It's a race against the clock, and sometimes it feels like the clock is winning. So, while these drugs offer a promising new approach, they are not a magic bullet. But no matter the challenges, the pursuit of a cure continues, fueled by the hope and determination of researchers, clinicians, and patients around the world. Despite these challenges, the future of immune checkpoint therapy looks bright. Immense strides have been made in the field of cancer research, and immune checkpoint drugs are a testament to that. These drugs, which work by essentially unlocking the body's immune system to fight cancer cells, have proven effective in treating a variety of cancers. However, like all medical treatments, they are not without their hurdles. Researchers around the globe are hard at work to overcome these challenges. They are exploring ways to enhance the effectiveness of these drugs while minimizing their side effects, a critical balance in any medical treatment. Through rigorous studies and clinical trials, they are unraveling the complex relationship between our immune system and cancer. One promising avenue of research lies in combination therapies. By pairing immune checkpoint drugs with other treatments, such as chemotherapy, radiation, or even other types of immunotherapy, researchers hope to boost their cancer-fighting power. This approach could potentially make these drugs effective against even more types of cancer. Of course, all these potential advancements come with their own set of challenges. Determining the right combinations of treatments, the correct dosages, and the optimal timing is no easy task. It's a complex puzzle, but researchers are optimistic about finding the right pieces to complete the picture. Moreover, scientists are exploring ways to predict which patients will respond best to these treatments. By identifying certain biomarkers, they hope to personalize treatments and avoid unnecessary side effects. This approach, known as precision medicine, could significantly improve patient outcomes and quality of life. In the battle against cancer, immune checkpoint drugs represent a powerful new weapon in our arsenal. And with continued research, their potential is only set to grow. As we continue to unlock the secrets of our immune system, we move ever closer to a future where cancer is no longer a death sentence, but a manageable condition. The future of immune checkpoint therapy indeed looks bright.